All right, welcome all you Contras, preppers, and purveyors of the G Camp and Camp Ponderosa out in Montana. I have two guests today. I've got Rabbit, our medical host, and Ian McDevitt. I'm gonna mess that up. Okay,
McDevitt, yeah.
and he is a medical extraordinaire. I reached out to him on X. He reached out to me after he saw my post. Like, I want people who want to talk about gear, training, education, and that stuff. And I cannot turn away from a medical professional because I know nothing beyond band-aids and bandages. And tell us a little bit about yourself and what your bona fides are. I'm going to let you do that because I think you know yourself better than I could read your thing. But I did want to bring up, he's got a website for all you guys in the medical field called vintagevalorwear.com. And he's got his story on there. So if you want to go back and look at it, it's crazy. But tell us a little bit about you, sir.
Okay, I've been in EMS probably for about 37 years. Do I still got you guys?
Yep, totally.
Okay, 37 years. I started out as a basic, EMT basic. I was in the United States Army Reserves before then. I went to IOBC as an officer in the infantry, went to airborne school, did all that stuff at ROTC from University of Connecticut. But I went to get my EMT basic before I finished college. And I found out that I liked EMS, so I worked as a basic commercially on an ambulance. Like Rabbit had as mentioned that he and his wife were both basics, EMTs. I worked back then, it was probably 87, so we worked probably 80 hours a week, which was regular. So I got what we call a lot of patient contacts. A lot of patient contacts, probably more than I ever needed. And I learned that there were, I finally had an affinity for something, and it was medicine, which I didn't know. And I was still in the reserves as a first lieutenant at that point in an infantry unit, a light infantry unit here in Connecticut. And I got, I had hobbies of shooting always and being on the outdoors, and I got involved with my local police department, city police department, because I had grown up with some of the officers. They were all just out of the Marine Corps. So we decided to start a SWAT team. So I had gone to, and just out of the blue, this is like the early 90s.
Okay, so yeah, that was the time when all the SWAT teams, besides I guess New York and Miami had a SWAT team, but a lot of the smaller places didn't have them. Now it seems like everybody's got one.
Right. They didn't have SWAT. Well, I'll tell you in the future, but there was when I was around when Boston PD was not a full-time team. They were a part-time team. So I used to go up there and work with them. So my little SWAT team started. I went to get my EMTI. After my EMT-IV, they call it EMTI, I went to paramedic school. And in 1992, I went to Saudi Arabia for a year on my first contract to work for with the Ministry of Defense and Aviation in Dhahran, Saudi Arabia.
Interesting.
Yeah, I went with the 18 Bravo. I went with a Special Forces weapons sergeant. Back then, they used to have, I believe, both heavy and light weapons. They had a distinction between the two. The guy I went with was great. We worked as a team. I worked with the medical side of MOTA. He did weapons in his area. I spent a year there working almost every day of the year because there was no break.
Yeah.
But I learned, that was my first bit of contracting, and also my first bit of learning about the Arabs and the Muslim community. And then it took off. I came back to America. I was a medic, and I worked doing intercepts alone for years. A lot of street time until about 2008. A lot of SWAT time. I worked in between that time period. I started working in Alaska on the summers. In the summers with a man named Chris Janowski, who used to run the World Survival Institute out of Tok,
Oh
Alaska.
wow.
And we started, yeah, we used to invite the instructors from the Marine Corps Mountain Warfare Training Center out of Bridgeport, California, up to Alaska. And they'd come up to Alaska and meet us for a month and a half of training up in the mountains. And I would do all the medicine for them. I would write all the medicine. Then I would go through all the scenarios with them up in the mountains.
It sounds
So,
like a Frozen 29 Palms for the Marines.
yeah, it was crazy. It was wild. They were great. They loved being with us because we used to pick them up and give each of them a rifle. I mean, a bolt action, beautiful scoped
Mm.
weapon. And as soon as they got there, and we'd take it back when they left. But it was a great time. So I worked with them. Then I stayed back, in the winters and the rest of my time here doing intercepts alone, working alone as a paramedic. Just going out on the most serious of calls, still doing my SWAT stuff. 2008, I got picked up by a company called MPRI, which was one of the first American contracting firms. It was
Mm.
huge. It was like military professional research, something like that. I can't remember what the initials were, but they asked me to go to. By then, I had written my first book. I wrote the first book on basically tactical medicine and law enforcement. I tried to join the
I
two
feel like I saw
with.
your book in the BXPX when I was in the military, because I looked up your books, and I the front of the book was very noticeable, and now they go from anywhere from $5.77 to somebody had one for $140. I don't know if that was a signed one or not.
Yeah,
Online.
yeah, yeah. Don't buy one of those. I'll send you one. Don't worry about that. And it's got to be
Mm.
updated. But I mean, what I found out is writing the book opened a lot of doors because within, back then they had the magazine Soldier of
Yep.
Fortune. I don't know if you guys
Oh
are
yeah,
older or
I am
you're
that
probably too
age.
young for
No, I
that.
know
Yeah,
that
I
book, and
remember
Okay.
that.
I remember the downfall
Okay.
of that book. I remember Paladin Publishing that was out of Colorado,
Yep.
and
Yep. Yep. Yep.
they all just they still exist. They're on X if you're interested. They still have a environment on X where they post stuff, but I haven't seen their magazines in so long. I don't know if they even are alive anymore. I feel like Recoil and them kind of, and even Recoil's having a hard time probably getting readers beyond, oh, I'm walking up and I'm an older guy and I like a magazine. I like a physical piece of paper. So,
Yeah. I agree with you. I do. I do also. I wrote the book, and as soon as that came out, had everybody from Seattle police calling me on the phone to all kinds of departments around America saying, "Hey, come and go. We're going to go over, bleeding and
mm-hmm.
breathing as the killer bees," is what I wrote. This is before March and that,
The,
massive
the
hemorrhage, airway
TC3
respiration
stuff and
circulations. Yeah, this was I was Butler was around and he was putting out his stuff and I was reading and sharing info. And he was the one that basically invented TC3 with the other doctors back then. He was in the Navy, commander, captain in the Navy. So I changed it though. I turned it into bleeding and breathing. And the two I used to call it the killer bees, and that's how I would get students to remember it. And so then I got a call one day from MPRI in 2008, and they said, "How would you like to go to Rwanda for us with the RDF?" And I wasn't. All I was doing was, hanging out here and doing a few calls because I had left my intercept
Mm-hmm.
job. So I was like, sure. So I ended up learning the business of contracting, which quickly evolved into like all kinds of intrigue and non-medical stuff that I tried to stick with just the medical stuff, but
Yeah.
but I just left that field. Probably I did probably 12 years back and forth and doing the contracting. And now that I've been back in the States 5 years, I came back. I knew that COVID was going to hit, and I was in Africa when it hit. I was actually in Equatorial Guinea when it
Oh
hit,
wow.
and we knew that. We knew it was going to hit because we got a briefing from a Chinese virologist when I was in. Because I had a friend. I was doing another
Hmm.
job. I was on an island called Malabo, which is off the coast of Equatorial Guinea, and I was working for another group. And one of the paramedics that worked for Exxon, female, said, "Do you want to get a briefing? We have this Chinese doctor coming." So she shows up, and I'm standing in the back of the room with her, and all the Exxon Meggy executives are there, and she tells them all that it's from a lab leak, that COVID is from a lab
Yeah.
leak, and that they're going to try to control it. This is what you can do. All these things, and I was like, oh, okay, And my first thought was, this is going to go sideways because as soon as this hits America, the Americans are not going to deal with
No.
this. So I remember that night I got on the phone to a friend of mine who works for a place in Langley, Virginia, and I said, "Can you get me home?" I was supposed to. I hadn't fulfilled my
Yeah.
contract in Africa, so I still had a few days left. And he said, "You're on your own." He said, "You got to get yourself home." I said, basically, "F you," and I did. This girl, used her Exxon paramedic credit card to buy me a flight home
Wow.
just before the Trump had, if you remember, he had closed entry into the United
Yeah, I remember
States or
that.
something
Yeah,
like
the
that.
ports of
Yeah,
entry ended up
yeah,
closing down, but I mean, let's be honest, kind of like what you were talking about. It took a little longer than it probably should have, and had already caused a little bit of the confusion and
Oh, the confusion was
disillusionment.
massive at that
Oh
time.
yeah, yeah,
yeah.
I
yeah.
had a guy I knew that I had read a germ warfare book, probably about 4 or 5 of them when I was deployed. That was my big spooky thing is chemical warfare and germ warfare because I grew up as a child seeing the Iraq War and chemical warfare, so it was a fear in the back of my head. And he brought it up, and I think November or December. He's like, "Hey, this may get over here, and we have no idea." He didn't trust the Chinese specifically, and didn't know. He's like, "They're not telling us everything, so be concerned." And later, he kind of cut back on it, and he's like, "I'm not overly concerned. Don't have any terrible medical issues, and you should be good. If you've got other issues, stay away." I haven't talked to him in years, but that was my experience on it.
Yeah,
And you were in an area where you Africa had that outbreak of the disease that was on the ship recently, and I remember reading about that.
yeah.
Uh,
Well, I had been in.
yeah,
Sorry to interrupt you, but I had been in already 3 outbreaks in Rwanda and Uganda of
yeah,
Ebola. So that wasn't COVID wasn't going to scare me. What was going to scare me
Yeah.
was our reaction to
yeah,
COVID. I knew, I could feel when I was standing in that room getting that briefing that the Americans were not going to handle
no,
it. So I needed to get my ass back because I didn't have any
yeah,
money either. At the time, I didn't have any cash to live in Malabo. This is an island off the coast of Nigeria, Equatorial Guinea. Lived there for three
yep,
months while Trump's got us, wouldn't let any flights in. So I that was my prime concern was getting home. I knew it wasn't going to be anything massive, and it turned out exactly the way the paramedics around here, the Northeast, knew it was going to turn out. The outcome, but yeah, I wasn't afraid. I'd been through a couple Ebolas and some worse things. Dengue, I've had it. I've had all kinds of diseases in Africa that would scare the living shit out of Americans.
They definitely got that's a whole nother animal over there. Definitely. I mean, you were talking about the Ebola, and you know, I track that Ebola flight or whatever that comes in and out, does laps or whatever, and it's constant. Like it's always amazed me that it's a constant. This is not something that just showed up one day. Like it's been something that we've been battling with for a while. So for COVID to kind of come out of left field and just, oh hey, we're just gonna full stop the entirety of everything, and we're just gonna, you know, it's like a truck going 100 miles an hour and you just stop on a dime. Well, okay, well now everyone's, like you said, you felt that you were going to get trapped and you'd been stuck in, you know, you would have been stuck in Africa for the whole
In
thing.
Equatorial Guinea,
Yeah.
yeah. I mean,
Or yeah.
I I funny enough, I have one of my Ugandan NCOs. I was talking to him while I was in EG, and he's like, "We are here if you need us," because the Ugandans are all over Africa doing mercenary work. And I said, his name was James, and I was like, James, he was my best NCO. I said, thank you, but it was just and all the EG folks are asking me, are the Americans, Ian, are the Americans going to come up with a antivirus? What are they going to do? A vaccine? What's going to happen? And I said, oh yeah, we'll be all safe. Really, I'm thinking I got to get my ass home because
Bro,
I
we
don't
need
know.
that toilet paper.
I knew
that toilet paper is where it's
oh,
at.
that toilet paper, right? And toilet paper. That I just know how certain entities in the world. This is what I've learned about 12 years of traveling. Will take advantage of something.
Yeah.
So even though, like my girlfriend's a great example. I love her, but when all she knew about COVID was what she was watching on the news. She didn't know that the paramedics, we didn't give a shit. The mask was annoying. Half of the time they had it down in their mouth. And every call, I would tell her, I'd be like, if it's serious, where are all the dead paramedics?
Yeah.
Where are they? Where are all the dead doctors and nurses that they if it's this the virulence is so potent, and I lived through Ebola. If the virulence was this potent that they were touting every day on the news, if you guys remember on the news, they had there's an outbreak in northern Connecticut and it's spreading. There's
all
patients.
the numbers, the data, every day.
I'm thinking, I'm thinking, how are they getting these numbers? Where are they? Who the hell's telling them these numbers? The
For something we don't even know
every minute.
Like
it was just
we weren't even even if we were tracking it. I mean, now granted, we're talking. I mean, it's interesting we're talking about this now, but I think we can agree that COVID changed the whole culture of viral outbreak / healthcare / in communication wise, because now everybody seems like it feels like the country and or people in general seem like they are so much more attuned, but like you said, we're all the dead field folks, everybody who's in the field. And I remember too, because they gave us cloth masks, and we were like, what is this even doing? Like, and it was interesting because we started taking, we were I imagine you were doing the same thing, but at our department, we ended up taking, they were talking about, you got to wear your SCBA, like go full, because I was, we were all in one service. And so they were like, hey, you're just going to put your SCBA on and you're going to shower off it every single call. And we would. And every single call, you'd have to change your bags, your mask out, your pack out, and then you do all this stuff.
Yeah.
And it was somebody who we went to every day. I went to the same lady at 3 o'clock. We go to the same patients. You all know we all got frequent flyers. Love them, hate them, whatever. And they'd, hey, I got COVID. I'm gonna get trained. I was like, okay, whatever, man. Like, and to be honest, I hate to say it, it was, you have those, running calls and stuff. I think the masks helped me out more with those the houses that you really didn't want to go into, like the ones that,
yeah.
Like, I'll be honest.
Yeah.
I'll be, God is my witness. Yeah, it kind of gave you an excuse because unfortunately my face kind of shows more than I say sometimes, and so having a mask was great because the patients wouldn't see what I was.
Yeah.
I have the same problem.
Yeah.
Oh God.
And I was like, oh man. So, and later obviously they gave us canister masks, and then it was actually really funny because we had I don't know about you guys, but we had a distillery give us 55 gallons of thickened vodka as a disinfectant, and they issued it via SOP to treat all surfaces inside and outside of all apparatus. And so we would pull up on scene and it would just smell like vodka all the time. I was like, this is going to get us sued so bad, dude.
See, none of these things though were based on science. They were all based on panic. And I'll give you what my opinion from being in EMS for this many years is, I think COVID helped wipe out EMS, because I know paramedics in the cities, New Haven, Boston, New York City, the closest cities to here, Hartford. Hartford has commercial medics that just had enough after COVID, and they were just like, "Fuck this! I'm done being a paramedic." And because that's the way it was, they were using this information on these EMS providers. They had these one guys, for instance, the city of New Haven, they had them using phenolic to clean all their gear. Phenolic causes cancer. It crosses the blood-brain barrier so thickly that I mean, they had him after every call washing down all of his gear. And he's like, this stuff is deadly. We're not even supposed to be touching this.
It's
But they
worse than
didn't
purple
have any
wipes.
knowledge. They were throwing this. Yeah, they were throwing this stuff at you. And a lot of people just gave up on EMS, and they gave up on responding, and they still have. And I don't know how it is down south where you guys live, but a lot of the fire departments, the volunteer departments up here are dying. There are no more members.
I don't know about
Yeah.
around here. I know some
There-
guys. I know some guys in.
You're lucky.
Yeah,
Yeah.
I know some
Well, I
guys
mean,
down here.
let's be
trying to
honest. That's my family. My family in a nutshell. You know, we you know, for anyone who knows us, not that it's a, you know, left EMS because of it. You know, I was tired.
Yeah.
You know, we were getting held every day. Like, yeah, between me and my wife got held for like a week because she had symptoms. So if you showed up on symptoms, you lived at the house. You lived at the firehouse. You know, nobody
Yeah.
knew what. And again,
Yeah.
like you said, everything that they were going off of was subjective information, and nobody was presenting any sort. And anybody who was presenting objective information was getting shut down, which was really frustrating
Yeah.
because, you know, I know I don't know everything. I don't even claim to know everything, but we smelled something wrong. We smelled like it just didn't feel right. It was like, hey, this is, you know, we had government officials sending us boxes of supplies and then taking it out of our yearly budget, but our chief never ordered it. And so they were like
Yeah.
doing some weird shit, like, and just like,
Well, that's only a little bit. You got to remember the
yeah, I'm
whole.
definitely.
If you may remember, is the ventilators.
join.
The ventilator. Remember the ventilator period where they were charging. There weren't enough vents, so they had people developing new types of vents. But every patient, this is supposedly, my ex-wife was in charge nurse in the ER. Supposedly, every patient that was on a vent due to COVID, the hospital got a bump from the government for it. So venting patients, what we know now, venting patients during the COVID time actually was detrimental to patients. It was killing patients. So we wanted to keep patients off of vent. But during that period, they were pushing for vents, and they were looking for, you know, vents to be 24/7 made and used.
Yeah.
So
And
it
like
was
the
just
stomach,
such
or was it the
bullshit.
dorsal therapy they were doing, or whatever they were calling it?
Just the whole operation was. Luckily, I was, thank God, at a point in my career where I was like, "F this, I'll go do something else. I'll go do
Just
something
a lot of
else,
noise.
man.
I
I'm getting
yeah.
too old.
I remember Rabbit
Yeah.
kind of had that moment for a couple other reasons. I'm gonna kind of sidetrack us off COVID, and I actually almost want to do a whole COVID thing, but I wanna actually pick your brain because you've done Africa.
Yeah, go ahead.
You have even more bona fides that I'm gonna go to later because just quickly you got a book. I guess you were worked for the Pope for a little bit.
I did. Yeah.
And I want to hit this, and I want to leave this as a I don't know, a little gift basket for people to find and go, oh crap, I want to hear about that. But I want to ask you, since you worked in Africa, and we were discussing COVID, what are the medications that you think most preppers would ignore and should have on tap? Because you're dealing with everything from generic diseases over there to Ebola to God only knows whatever else.
Okay.
What are some things that you could say, you're a generic person, you don't know snot like me. What
Yeah.
would you keep in your house, and what would you keep a lot of, or at
Okay.
least a little of?
No, good question. Good question. First is, like, Rabbit already knows, is any medicine that you're on a regular basis that you should have it. You should probably have 3 months stored up of. Like, let's say your son or daughter, God forbid, has a history of seizures, then they should have 3 months of their seizure meds stored up of minimum. Now that's prescription med. Now we're talking, if you're talking like OTC meds, I would get things. It depends on the demographic of your family. Like some of you guys, I don't know, it's none of my business, but may have young kids. If you have kids, then you want to get like Motrin, and you want to get Tylenol. You want to get things that are, for the seasonal emergencies, like cough, cold, high temp, ear infections. So anything Clavamox, get an extra script of Clavamox from your doctor for ear infections for children. If your wife is an asthmatic, then you want to get at least 2 or 3 MDIs, the meter dose inhalers, ipratropium bromide or albuterol. You want to have a couple of those things, those at least laying around. What I would do also, if my wife was an asthmatic, just as an example, I would go to like Amazon, and I would find a battery powered, either a Pulmo Aid, which is a little device that pumps the nebulized medicine into the patient's lungs. Now I would get one of those, and I would be able to run that off, a battery pack like a Bluetti or a Jackery battery pack. I would do something like that. So first thing, those are the first things you want to do: medicines that your family needs on a regular basis. Then I would hit meds like Tylenol is a great med. You can take a gram a day if you had to for pain. I use it IV. I have it in my bags for IV push for gunshot wounds. I use a gram of
Wow.
Tylenol.
That's interesting.
I don't use narcotics.
Mm-hmm.
But I mean, these are meds. Like, you can't have enough meds, because the meds, if you don't need them, somebody else is going to need them, and you're going to be able to trade the meds.
Yeah.
So Tylenol, Motrin, Imodium, okay, Pepto-Bismol, Colace, stool softener, all meds. And don't go into the store with the mindset that it's stuff. You're fulfilling already your prescription meds that your family takes, but you don't want to go in with the mindset of just what I think I'm going to need. If something's on sale and you see it's a good buy it, because if you don't need it, I guarantee you your neighbor or the person down the road is, and you're going to be able to trade them something for the med. The thing about medicine, this is what people don't understand. The thing about medicine is, I'm pretty secure in what I know in the area where I live in Connecticut, because I know that no matter what someone else has, they could have an armory full of firearms. They could have gold bars out the ass. But I'll tell you what, when their little kid has an asthma attack after some type of collapse due to civil unrest or natural disaster, their kid has an asthma attack and he needs a nebulizer treatment with oxygen, he's going to be kissing my ass.
Yeah, you could be starving,
he's going to be
and they
trying
will,
to get
do
that
anything
thing
for you afterwards.
People will do anything they can to get a medic to save somebody they love.
I think everybody.
Rabbit, I'm sure.
Yeah, I think both of us are staunch anti-communists. But the one thing that they do have that they've pushed their whole time is they are very skilled on training for medical reasons. Che Guevara did medical stuff in Cuba, and that's a drive, and people forget about that because nowadays modern medicine's on the doorstep everywhere in the United States. You can go to Walgreens, you can go wherever else. And COVID, I think, cracked some people's image, but now we're back to the normal life, and I have a cold, I'm going to go get this. And I know other countries, because I've traveled a little bit, there's places that's not the case. And some of those places, they keep Tylenol, they keep some, and the generic stuff, and they don't have a lot of it. But they carry different stuff than we have, because we have a plethora of, I'm going to go to the doctor tomorrow. I'm going to go get this.
Well, we treat it like any other logistics in the country where, hey, I need it, I go get it when I need it. But like you were saying, the two things that to me, I have to have is stuff to make you go to the bathroom and stuff to make you stop. Because those are two nightmares that you don't want if your water's shut off or, and the other thing we were talking about we were talking about Soma and stuff was dental care. We were talking about dental
Yeah.
and using that and being like, hey, look, like, military trained me a little bit, because we were talking about like preventative medicine. That was our big, obviously that's the whiskey skill, and there's obviously the MOS specific about straight preventative medicine. But I mean, that's kind of part of it is
Yeah.
like, hey, like, being of the mindset of stopping this stuff before it becomes, if you have a little group of folks, you need to stop it before it becomes big because you'll never have enough meds, as well
Yeah.
as,
That
you
comes
know,
to, listen, you specifically, your family unit, if your wife and your wife are both medically trained, everybody in that family, I don't care, you got grandma or grandpa or their kids, should be able to take a pressure. They should be able to take a pulse. They should be able to place a pulse ox on the finger. They should have, be able to do a basic assessment for you. And because anything with medicine,
man,
you want to
like a
disseminate the
man after my own heart.
skills. You gotta disseminate the skills. So even if you got kids, if you got, I don't know, I'm just saying, if you have a 12-year-old, he should be able to take a pressure. He should be able to get you a set of vitals. And this is the reason, because he can either help you work on a patient, just like I would have a BLS provider. I'd be like, hey, take a set of vitals while I put them on the, put an IV in, or take a set and then put them on the cardiac monitor for me, and I will put an IV in. So we're making the most of our time with this patient, and I'm utilizing my resources just like you should. You're going to teach the kids basic assessment, head to toe. I'm looking at the head, and when they do their assessment, they're talking to you. Hey, Dad, I'm looking at the head. I'm looking at his eyes. His eyes equal and reactive. Okay, I'm looking in his ears, Dad. The ears are clear. I don't see anything. I'm looking up his nose. There's no blood. So have them talk you through a secondary assessment. But the best part about medicine, the first thing I would do if I had friends that didn't know medicine, is I would disseminate what I knew as quickly as I could. I'd have them doing a pressure once a week. I'd have them doing wound packing. You can do it on anything. You don't need to make something. You don't need to buy a wound cube. There's a guy I saw on X the other day making something, and more power to him. But you can have them doing tourniquet application, and then not only an application, but you got to remember, you're going to have to reduce the tourniquet. You're going to have to back that tourniquet off. So you're going to have to
Mm-hmm.
teach that skill also. But
Yep.
disseminating medical information is what you guys should do
I've
in whatever
I have
class.
never heard anyone beyond a doctor turn back a tourniquet. I know that used to be a actual skill that was taught previously because my parents kind of knew that. And background, I don't know how to do any of the stuff that you said.
Yeah.
My best friend came from that world. My wife's a nurse, and my parents were
Mm-hmm.
firefighter, medical, and I ran away from the medical stuff. That said, a lot of these skills that I think you probably know because you were traveling, and the defining knowledge over there is different. Like the limiting knowledge that you're allowed to do over there is totally different than what the U.S. is.
Oh yeah.
A
Oh my
rabbit
God.
has we've spoken about that a lot in
Yeah, that's
previous.
it's been a big premise because it's always been, everyone wants to talk about the gear. Hey, what's in your bag? What cool tools? Hey man, I wanted to learn how to suture. I was like, okay, well, do you know how to take a blood pressure? Do you know how to take a
Mm-hmm.
pulse? Like, it's not the fact that I want to gatekeep it, but at the same time, balancing that out with, hey, even if you gave me a phone call, and I think anybody medical can attest to and be like, hey, if you call me and we're doing telemedicine for your friend, but the friend doesn't know how to, oh, hey, how are you presenting? Like, hey, what is your issue? Like, what has your trend
Yeah.
been? Oh, well, we haven't trended anything. It's like, oh, okay, well, have you gotten sick? For anything. Hey, going to the bathroom normally. What's your
Yeah.
vitals, all this other stuff. And granted, or I think anybody, and I can say myself, sometimes you could take that for granted, and you're like, oh man, like no, that's usually what I do. That's what the professional does, and you sit in, and you gather all this data, and then interpret that data. But teaching other people to get that raw data for you could be pretty immeasurable because you can do it over a radio, a phone. I mean,
Yep.
all sorts of vectors.
Scout even pushes that
Yeah.
on a tablet, like, and that's the thing is like when we did our RTO advanced RTO course with NC Scout, he brought that stuff up and putting that information on a tablet. Now he didn't deep dive it because that's not his genre of stuff. He's got other people that do that, including Rabbit, sometimes assisting. But it's knowledge that we don't have. And I remember as a kid, we had a BP cuff at the house. We had stethoscope and bandages. I had I had a whole bunch of bandages from probably Vietnam or something that he just got stockpiled somewhere or surplus stuff. But I don't know anyone nowadays that surpluses anything like that. My church, we've got a person who literally sells equipment to yachts, and they have crazy cool stuff they get because they're international traveling on those yachts. But
Yeah, I
the
bet. Yeah.
local normal people have nothing, nothing. Um,
Yeah.
so let's kind of kick it back to Africa. We talked a little bit about
Yeah.
meds. I remember I had something like silver cream or something like that. I Silvadene
Silvadene. Yeah.
for burns, but that also worked on sunburns apparently. Is there anything
Hmm.
like that that you can get a hold of, like maybe from a doctor that you want to keep, or and also would you get a stethoscope? Would you get a BP cuff? And where would you go to learn that as a generic Joe on the street kind of guy? Do you have to go find a medical professional, or is there somewhere where that is easier to like learn? If that makes sense.
Okay, I never throw any medicine
Okay.
out. So I have, because I've been in villages in Africa, there in West Africa, where they sell only expired
Okay.
meds. So I've used expired meds for years. I've never had a problem. I've used them on my parents before, expired medications. So uh, t- it's the expiration date doesn't scare me at all. There's different specific meds and solutions, and different mixtures that I would look at before I push them or use them. But I don't throw anything out. So that's one point. The second point is, yeah, I have a huge several containers full of different types of creams and lotions that are steroid based. The Silvadene is great. I use that all the time. You can in these other countries, remember, like Africa, you can buy all that. That's OTC.
It's over the
There's
counter.
no
Yeah.
prescription needed.
I
Yeah,
got that. I had
yeah.
that
Like
when
when
I
I
was
was
overseas and just picked it up.
Yeah, it's great to buy. When I was in Uganda for my I used to be with the Yuga Bag, what's called the Ugandan Battle Group. I was attached to the battle group. I had to get their meds. I would go to the pharmacy in downtown Kampala, Uganda, and I would buy a 500 milliliter bottle of morphine. It's this big. It's bigger than this, and it was full of morphine, and each milliliter, it's 500 milliliters. Each milliliter, I believe, was, I know the capful was 5 milligrams, which was is an adult dose of morphine, and that's the capful of the bottle that I buy,
Wow.
and they sell it to you right there in the pharmacy. It's in a bottle, it's green fluid, and it says made only for military use. And I would buy it right over the counter in Kampala, Uganda, and I'd take that with me for 3.5 month operation, 3.5 month deployment. And so, I mean, it's so strange buying meds over there as it is over here. I just developed a habit where I don't throw out meds, and I keep everything. Everyone knows that in the house. They know that don't throw anything out. I Let me think. I'm getting off track
You're good.
now. So the meds that I keep, I do keep all the creams. The Silvadene is great. I would keep it, even if you had it 5 years ago from when you were in the military. I would still keep the tube and I would still use it. Now, you have to know when to use it. Technically, in America, we use one tube per patient, but it's just like nitro spray. We're supposed to use one tube of nitro spray per patient, and we didn't do that as paramedics. We continued to use it with every patient. So it's just, it's as long as you treat you treat your stuff correctly. You learn all that. Um, rabbit, I'm sure knows how to keep things aseptic, which is basically clean, with a fancy way of saying clean
Mm.
medically. And if you keep things clean, you should be fine. I've used multiple tubes of Silvadene on patients. When I didn't have Silvadene, I'd use honey. I used honey
Oh,
often
really?
Oh, yeah,
as an
yeah.
anti.
We were
Yeah, I've
talking
used it
about
on
that's.
Americans.
I,
I've used it on
That's
Americans.
interesting because we always hear that as a antiseptic, and it's kind of like salt. It doesn't matter if the salt gets wet as long as the salt is there, it's still salt. And honey seems to have that
Yeah,
same like nature. You can get it hard, but all you gotta do is heat it up again, and it's back to
you're
honey,
right.
Yep.
You're right.
and
Well,
it's very
yeah,
portable.
yeah, and that was
Yeah.
actually. It's
It.
funny you're talking about that because all this stuff start making a resurgence, even in the, or I don't want to say it's making, because prolonged field care is becoming the big hot topic of
Ukraine
military.
specifically too. They're having a
Yeah,
hell of a time with that.
It
yeah, and so
is.
like ultimately that terminology is what really, we started doing it and we all say, oh hey, the golden hour, it's dead, and hey, yeah, that's true, but it's just because we're in a different conflict and handful of other things.
Hmm.
But um it's interesting that you say that because now they're even pushing that doctrine out to Soma and at those classes. That was the first time, I don't want to say in a professional setting, that I heard somebody being like, "Oh yeah, you
Hmm.
could put one." I was like, I knew you could, I know, like, you
Never heard
read any
anyone do
old
that.
book. Yeah,
Yeah.
yeah. Well, I mean, you talk
Yeah.
about any holistic medicine, honey always shows up, garlic always shows up.
Yeah.
Um, there's a handful of things that are always, vinegar always shows up, and now those ways are starting to show up in the field in the US military, like for
Yeah.
guys that are operating
Yeah.
in weird environments for extended periods of time where logistics chains either don't exist or are stretched very thin. I mean, it's
Yeah.
part of it.
Some of the you got to remember also is there's crossover meds. There's meds that you can use on animals that you use on humans, and I've done that all the time. There's specifically there is a manuka honey based silver ointment that's good for wounds that to use on humans. My girlfriend's dad has a really badly infected finger he owns a farm. He got it infected with bacteria from the farm that's unknown after several attempts at culturing it, and they decided to use manuka honey on it, and it's working.
Interesting.
So I would
Years of
this
modern
this stuff I
medicine.
can't think of the name of it. Yeah, I can't think of the name of this damn stuff. It's on Amazon though. It's silver impregnated manuka honey, and it comes in both a spray and a cream. And if you had, like, let's say you had just a little BLS kit, basic life support kit, with bandage material, and you had some of that in there, you'd have a better chance of staying alive because you're going to avoid an infection. You're not going to need those antibiotics later on down the line
Yeah.
because you're going to fight off
Yeah.
the infection there.
Yep,
That's
it's
it's
I think it
interesting.
might I think I got it. I got it $24 on chewy.com. So I can, and it's silver honey hot spot and wound
It's
care,
yeah,
for
it's
tissue
in like
damage,
it's
and
silver and
but
yeah, it's like a silver and white like squeeze bottle or something like that. I can't think of
yeah,
it.
about two
I'll show it to you next
ounces.
time. I'll show you a picture of
That'd
it.
be cool.
Yeah, yeah,
Yep.
yeah.
Yeah, I'm picking up a handful of them,
I
but
use it often.
yeah, I didn't even think about having I mean, obviously silver is in a bunch of stuff too for bacteria and
Yeah, I mean that's part of the reason why silverware existed back in the day too. Because guess what, silverware is easy to
yeah,
clean because it already kills off of the stuff that kills you.
Yeah.
exactly.
So
Silver actually kills, I think, 700 known bacteria, and antibiotics are usually geared to kill around three or four
yeah,
specific. So, silver as a general antibiotic applied topically is really good, and mix it with the honey where the bacteria can't grow. It's really good. I mean, you're doing 10 times better than you would with just the wound
I
dressing. by
I hate
itself.
to ask this question because it is a stupid question. I was watching some YouTube short video, or video is longer, but they were showing like somebody cooking food in I'm gonna assume the South Pacific area, but it was just garlic. I mean, just tons and tons of garlic that they threw in the water. And the guy jokingly said, "Are you trying to get rid of parasites?" So I'm gonna ask the dumb question: have you ever seen garlic, like heavy ingestion of garlic to remove parasites? Is that a myth or is that something real?
Mm, I have not, but I have heard of hot
Okay.
peppers. Hot peppers, but not
I think I'll
garlic.
just die from the parasites.
Um,
I cannot deal with hot
yeah,
peppers.
yeah.
Oh,
You know what what we used to do is we would before you as you're on the plane after a 3.5 month deployment in anywhere in Africa, I'd give each of my team a little bottle of like mebendazole, albendazole, and they would. It's the same thing you give your dog for like heartworm. And as they're on the plane, they can only do it on the plane because that way they would contact nothing from the host nation.
Yeah.
Everything would be from that closed containers. They would take this shot and it would kill every worm that they
Huh.
had gotten over the last 3.5 months. So I had one of my buddies, the guy I worked in Italy with, calls from Italy. He's like, "Hey man, I just looked in my toilet after I just took a poop," and he's like, "It's full of dead
Oh, I am
worms."
terrified of doing
And
that
I
oh
now.
was,
yeah.
I was, I said, "Good." I said,
That's
"You're
a good
welcome.
thing,
You're
dude.
welcome." Yeah, I know. I
Hot
know.
flies creep me the hell out, and I watch videos of those things. I don't know why, and because I was always scared of getting bot flies when I was overseas in certain areas. They're just creepy things. But the worms
Yeah.
internally probably are like if I ever have that bowel movement, I'm gonna be creeped out. I don't know, a rabbit. Do you have the book on poop, the medical book that talks about the stools, or was that just
Oh, the,
something?
The different sizes and
yeah,
shapes
yeah,
and
yeah.
consistencies.
It's
Yeah, I
pretty.
know. I know it.
Yeah, pretty much the everything to do about poop or whatever. I can't remember. I
Yeah,
think it's the one I have is a nursing um it's a nursing book. It just talks about because ultimately your poop's going to tell the story.
yeah.
If
It'll
you can describe
diagnose
that, I can pretty
supposedly what's
much
wrong.
kind of figure at least get in the ballpark.
Yeah, yeah. As long as you got to remember food allergies. Anybody that's like lactose intolerant or is gluten intolerant, then they're always going to have a little bit of you know
Yeah, and I
runny
mean,
number two.
and that's
Yeah.
again that would even touch on the next thing of like getting your family's normals. Um, and getting the pattern not only of just yourself but your immediate family members, your group members, or whoever, and be like, hey man, like I don't know, I maybe it's just because it's I've always I started my adult life as a an EMS or whatever, and military you kind of taught you to ask the weird uncomfortable questions and you know uh see more naked people in very undeserving positions,
Yeah,
but at the same
yeah.
time you learn to be like, hey, like that's just part of the job. This is a professional environment. I need to
Hmm.
know, um, is this normal for you? If not, like, do you know what's normal for you? Because they're not paying
Hmm.
attention. They're not looking at these things. And that came into, we were talking about in and outs being part of like extended stays or prolonged field care, and evaluating a patient's in and outs in the field and how you can do that and why that's important. Um, and ultimately, what that means for anybody is like, hey, how much are you ingesting via mostly it pertains to water, and then how much are you urinating, and making sure that those amounts match, to show that your kidneys and are still functioning properly. And
Hmm.
it does a handful of things, but it's pretty important because kidneys are kind of a weird organ. If you look at them the wrong way, they just start freaking out. They're pretty, they don't, they have a very very tight tolerance before they get a little aggravated. But so we will like to watch that in a field sense. And I remember that those were things that we were teaching people, and like, hey, like shoot, we got even taught how to use an Nalgene bottle, and be like, hey, here's a
Yeah.
BS non-Nalgene bottle. It has the granulated, numbers on the side. Hey, man, this isn't perfect, but that's just for that one instance as well. But ultimately getting to know your people, your wife, your kids, your friends, the people that you think that you might have to take care of or whatever. Hey, man, like you said with the medicines, not only what do you take, but if this is oh, hey, I normally have that rash is normal for me. Like I have, I
Yeah.
have eczema, I have this, I have that. Oh, hey, okay. So when I look at it, I don't freak out and say, oh man, that's abnormal. I need to work on that. Oh no, man, that's I have that normally. Okay, cool. Like,
Yeah. That's part of your your initial assessment is once you're if like well, just as an example, let's say I get there as a paramedic and I get to talk to the patient while I'm talking and there's two EMT basics there or a basic there and I can say, hey, do you mind if my friend Rabbit takes your blood pressure while we talk? And the person's like, oh no, what? So he takes the blood pressure and I say, okay, ma'am, what's going on? And she says, oh, I've got pain in the chest. And I say, ma'am, can you point with one finger and show me where the pain is? And it's a good way for you to gauge what's going on. If the patient points at their belly button, then I know that we've got some issues there.
oh
It's
yeah,
probably not cardiac if they're pointing. But see what I'm doing? Just by a couple quick questions, we're getting two things done. I got Rabbit taking the vital signs quick for me. Going to put the patient on the cardiac monitor. I'm gaining a patient history. We're establishing a patient rapport. Soon I'm going to sticker probably before we get in the rig with a needle, put an IV in her. I'm going to be able to do a better assessment. She's going to be on the cardiac monitor. So that's part of your call. Any emergency, even when you do with the family, it's flowing. The call has to flow. By call, I mean the emergency.
yep,
It flows by you doing each of these steps of things. You do the initial, hey, my name's Ian, I'm a paramedic. What's going on today? You probably do that 50,000 times. And then they start to talk and you listen. And they say, man, what's your age? And then like Rabbit said, has this ever happened to you before? That's a big one because it saves you time. If you say, hey, Rabbit, has this ever happened to you before? And he says, yeah, it's happened. And then I say, my next question is, what did you do for it? And he says, I went to the doctor. And I say, my question is, what did the doctor say? And he says, oh, he said I had, cardiomegaly. And I'm like, oh, shit. Okay, here we go. Then that helps me narrow things down because he's complaining of the same pain. So instead, it helps speed up my assessment and in turn treatment and their ability to make it to the hospital alive or make it back to the camp alive or us to fix this problem. So yeah, having your set of questions, that's just like teaching patients vital signs, is having your own set routine of how to approach a patient. Now, this is in non-emergency. We're talking about like austere medicine or remote medicine.
That is
But
a
in
question I want to touch on because I'm trying to do like a 50,000 foot view, and then I'm gonna probably get you on again and dig in deeper. But because I'm a big fan of H2Go, a company. It's a thing that turns salt into sodium hypochlorite, and they've sold big machines to Africa for hospitals because they can clean stuff with it. But the austere medicine side, I want to ask you because we've asked what do you keep at your house and the medication and some other stuff. What would you recommend for people hiking and camping and stuff like that? What is the bare minimum you say take with you on a like couple day trip and you're going to be out and back?
see, I'm kind of, it's like asking a gun guy what he's gonna carry all kinds of
Well, and
shitload of
for an
guns.
average
It's the
person who
same
doesn't
way
know
as
much, that's
asking a
okay.
paramedic.
Fair enough.
Paramedic's gonna have this giant bag. Now, I don't want to. I usually
For your own personal use. So we're not talking about a.
what yeah, okay. No, good. That's
see,
a
I
fair
have a
question.
bag for
What
every
I do
date
is
that I'm going on, so that's just the way it is.
yeah, you could do that.
And three
What I
Sherpas.
do is I try to I that gets into like an MTA, if you want to get technical, medical threat assessment, which is you're doing a geographical environmental survey of the area you're going to. This is part of my job that I did in Africa. You did MTAs of all these cities for us, the United States. But so I would do an MTA of my little trip, and let's say it was, my best friend's a paramedic right now. So he has a Land
Same.
Cruiser. So okay,
Not a
so
paramedic,
can you
but yeah.
imagine the two of us going on a
Yeah.
trip like 300
Yeah.
miles? This Land Cruiser could go, it's like ready for the goddamn apocalypse, the zombie apocalypse. There's medical bags strapped to the top. There's
Yeah,
like these two
tough
different types
boxes
of
all
radios
locked
in it.
down.
Yeah, there's tough boxes. There's body armor hidden behind the seat.
That's my
But
kind of
so
trip. That's our G
yeah,
camp
but I
trips.
mean, that's just because we're like way over
Yeah.
prepared. What I would do is I would plan on stopping any kind of bleeding, both major with a tourniquet, grab one of those little snake staffs if you have to, the little small ones, tourniquets, or I would use a SWAT T, which I use often. I know people have their own opinions on them. And then I would put a SWAT T, I would put some rolled gauze in there because I could do anything with rolled gauze. I can pack wounds, I can make a sling, I can cover a burn. You can even cut a little piece of saran wrap, put it in there for burns, to put it over the burn. I don't usually put any airway stuff. If it's going to be an austere medical situation, it's probably not going to. There's definitely going to be no endotracheal tubes and anything like that. Maybe a BVM, a bag valve mask, but probably not, because the reason is in austere and remote medicine, you got no chance of getting out of
Yeah.
there. So you have to triage these patients, and I've done it many
How do you
times
feel about those
where
nasal, those little nasal things? Rabbit, you might remember the little green things that you shove up the nose. Because I remember they were in everything. Yeah.
Yeah. Yep.
Your NPA, yeah, I think it's a fantastic airway. The problem with the NPA is, this is one of the reasons, we'll get into it another time, but I've never been to Soma. We back when Soma started, we kind of didn't see eye to eye. So I one of the reasons is I kind of break some rules.
Okay.
For instance, with an
Yeah.
NPA, one of the rules, hard and fast in EMS, is with an NPA, you don't put it in a patient that has suspected like facial fracture or fractured
Okay.
skull. Now, I have put them in hundreds of patients, from heroin overdoses, alcohol overdoses, struck in the head with a baseball bat. The thing is the person's so fucked up that I need an airway. So the least of my worries is ventilating their brain with an NPA.
Okay.
If I'm going to be ventilating their brain, they have a lot more problems than
and the average guy
they're
going
probably
down the
not going to
road
make it.
who's packing like, and the reason why I bring this up is like somebody.
I know what you mean. No, should you, as like say the average Samaritan that's got an
I've got an
IFAC, have
IFAC.
one in
Should
there?
should I carry that with me,
Good
or
question. Good
should
question.
I not?
Well, the only reason that you would carry it would be for you, or God forbid, your wife or somebody in the family. But I wouldn't be whipping those in everybody, even though you can put them in someone with an intact gag reflex and that's breathing on your own. I wouldn't be whipping them in everybody. Now they're kind of going away, as are chest decompression needles. They're kind of going away from IFACs. If you notice on the internet, IFACs they're disappearing. The chest needles and NPAs. I think that if you are loaded up and going with your wife and whoever of other loved ones, yeah, bring in a 32 or something like that. That'll fit everybody. It's not a bad thing. You can keep their airway open, and you may need to while you're doing some other work on the patient, God forbid. But if you're going to bring an NPA and you're going to go that far, you should probably have a pocket mask too. And a pocket mask, Rabbit knows what I'm talking about. I can't bend my hand that way, but it's like a big circle, and you put it over the nose and mouth, and you can breathe through it. So
I
you can
know
just
what those are
assist
too.
ventilations.
Because
Oh, okay,
no,
I'm
you're
sorry.
good.
You
I'm
can
glad you're
assist
saying this
ventilations.
because it is audio, and it's like SOMA, Special Operations Medical Association. You knew what that was, and I should have said it earlier too. For the
Oh yeah.
people, a lot of our listeners all know what it
Cool.
is because they've listened to us. But it's
Yeah,
nice to
yeah.
bring it
I mean,
back up and explain that.
We got to keep it element. We don't know who,
Yeah,
but it's funny
they
you
could be as
mentioned
dumb as
that,
me.
and I think it's funny. Well, maybe we'll talk off air or whatever. That what you're talking about with the facial trauma and all that other stuff, that's kind of going away. Not this past year, but the year before, they started talking about it and kind of loosening it up. One, um,
yeah,
S supraglottic airways are becoming much more popular, just due to their ease
yeah.
of application, and which um,
Hmm.
that has become. I'm not. I will not. I want to say it
Vindication
the right
is on your
way.
face. You can't see it.
Yeah.
Yeah. And
Vindication,
so like
and
I have my
yeah,
opinion
you've
about
been.
them because I want to say it the right way. Right now, it's not the fact that it's taking over innovation, because a lot of people are like, oh hey,
Yeah.
that's the gold standard, and hey, that's what we're supposed to do. But
Okay.
at the same time,
Oh,
it's interesting, and this
God.
is where we all know that there's a doctrine somewhere that says something, and everyone has their thoughts on like, hey,
Yeah.
and
Okay.
I've
All right.
seen over the last 2 years a lot of those staples are wavering in determined.
They are, but
Yeah,
this is that what because what they got. They're getting a lot of info out of
Yeah.
Ukraine, a lot of
Oh yeah.
battlefield info, and they're getting a lot of battlefield info from the
Yep.
Israelis. So they're changing their tune on a lot of things, but they had. I mean, for instance, one of the things that they're getting out of Ukraine is that they need to move the entire cache, the combat support hospital, in whatever form it is, right up to the battlefield edge to keep some of these patients alive. So they're finding that the techniques that we used in the past are not going to make it when we meet another near peer or peer conflict like
the
this.
the
So
shocking part of that you're
we're,
bringing up is a lot of that stuff is World War II doctrine that they had
I
pushed, and
know, I
I
know,
wrote 6 articles on drone warfare, and I'm no expert at all on that.
yeah,
But one of the sections I directly pulled from the World War II manual, and they were talking about how to set up those sites and how to conceal them from the enemy because they're so close to
yeah,
the front lines.
yeah. And if you notice, then there's I read everything that comes out of there medically from everybody, and I still have some from having worked there. I have a couple friends still there in the area. Um, neck armor, shoulder armor is back in play because of the way that the weapons, drone attacks, any type of air burst, they're finding that that we're going back in that direction where
Yeah, you didn't
you
see
don't
that. It's not on the plate
you didn't
carriers you
see
buy in the
you saw
U.S.
guys,
Yeah,
yeah, yeah, you saw the guys would trash that
yeah,
in Iraq.
yeah.
They would
Oh yeah,
throw
we
that
took it
shit
off. It
out,
was hot.
like
It
the shoulder
sucks.
armor and
hmm
stuff. But
all
now,
the
like
lats, all that
you're
stuff would, yeah.
yeah, you're gonna find that some of that in some form is gonna
I
come
can't
back.
remember
But
the
as
I
far
can't
as
remember the numbers on the kills for the Russian Ukraine side of the warfare, but almost all the kills on people now aren't even gunshots. It's indirect
yeah,
drone warfare, dropping explosive charges and that stuff, and it's back
yeah,
to the artillery days. It's back to the mortar stuff. And one of the cool things in World War II I did not know that the Americans were like mortar everything, bomb everything, artillery everything. If there's some shrubs up there you don't know about, hit them. And that's been what the drone
yeah.
warfare has gotten to now. They're just dropping whatever they can everywhere. So,
Yeah, I think there's gonna be a big change. But about your airway point, the reason, like when you use an eye gel, you can teach someone to put an eye. You could teach. I could teach if you guys. If I was at a class of yours, you gave me one of your students for 5 minutes, I'd have him putting an eye gel, an airway in, and 99% correctly the first two times.
Oh yeah.
That's how easy it is to make
Yeah.
to put an eye gel in, an upper airway. You're not going below the vocal cords.
Yeah, they're
You're not
almost
going.
easier than an MPA, I think. I mean,
Yeah,
if not
yeah.
equivalent, and I think they do have that for as in the
And
plus column of
it
hey,
take
ease of active or ease of installation. That's the
insertion. Yeah,
insertion.
insertion. The problem with the eye gel is though that someone's got to be careful with is yeah, the eye gel. You can do the eye gel maybe in not necessarily probably in tactical field care, maybe tactical patient evacuation. So your third stage of care in tactical medicine, you can eye gel, or anyone in the team should be able to eye gel. See, now the thing about intubation is a skill that has to be maintained and that degrades. You have to intubation, you got to be a hot shit to be able to intubate without a glide scope nowadays. Like my student up here works in a big city and he in Connecticut and he does you know, he uses the video scope to intubate. I never used it in my life,
What's a
and I think I
video
had a
scope?
99 point. He yeah, he sticks the it looks like a damn thing that goes down a drain, and it's got a video camera, and then he sticks the endotracheal tube down it, and it goes into the trachea instead of the esophagus. But I used to do that in the dark with a flashlight in my mouth and intubate. And intubating is the only way to have a definitive airway, period. In medicine, there is no more definitive airway than to be intubated. And eye gel is fine. I just had surgery and they put eye gel in me because I wasn't moving and they weren't carrying me anywhere. I wasn't going to be turned upside down. There was no chance of somebody tripping while they were carrying me and me being jostled and the eye gel coming out. That's the reason they use the eye gel.
Yep.
If there was a chance, like there is in tactical medicine, in long carries to the helicopter across a field that's all rutted or under fire, then the patient probably should be intubated if they're unresponsive, and they should be ventilated. I'm still, because I'm an old guy, I'm an intubator, but I will eye gel and I will NPA. You know, I usually put an NPA in myself during class to show these guys it's not a big deal, the students.
Do you
But,
you teach
yeah,
public
that's the reason
courses?
for the
Do you
idea.
teach courses to the public at all, or do you do it just for like trained personnel?
I honestly, I was teaching for a guy from my old days at Blackwater. I was teaching for a guy that lives in Connecticut, and he would just have people come down from New York City that old, well-off families that thought that world was going to collapse and they wanted to learn some medicine. So I would just zip down there. They weren't serious students though, but otherwise I don't really teach that much anymore, except I have a couple pupils, I guess you could call them, that I'm mentoring. Otherwise I'm basically retired and just.
Well, I just wanted to make
hanging out with
sure
my
because, like, if you're
dogs.
teaching classes, I'm gonna direct people to you. Part of our thing too.
No,
Okay.
no. Thank you. Thank you.
Maybe you need to.
No, I don't think.
From the sounds of
I
it,
don't
with
know.
your knowledge base, like it's interesting because, and I need to pull up your little bona fides again because it is your story is. I'm gonna have to come back to you, and I say that to a lot of people, and I will do it because I know Rabbit will probably kill me if we don't have more conversations. But from the African Union, I know you also in here talking about the Pope, and you wrote a book called The Pope's Paramedic, and it's insane the amount of knowledge that you have going on. And I guess you were in Ukraine in 2015 as well.
Yeah,
so,
I worked in Ukraine. I worked in I was did a couple jobs in Afghanistan, in Iraq. I was actually the embassy paramedic in Afghanistan with a crazy group called Armor Group years ago. But
I actually know that name.
Oh my gosh, yes,
okay.
I know exactly.
You don't
want to
know
about.
these guys. These guys are lunatics. But I was, believe it or not, I don't drink alcohol, so that didn't go over well.
Yeah, I don't drink either.
Absolute party maniacs. Um, I got out of there alive though, and I learned, and I went back to Africa. But I worked for the French Foreign Legion and around Agadez and Niger,
You worked with a
that
French
part of the
Foreign
Sahara.
Legion? That's
Yeah,
crazy.
yeah,
That's awesome, man. Oh, yep.
right
Yeah,
there.
he's got a.
Oh yeah, thank
He's,
you.
C'est Afrique.
oh man, oh, I'm gonna have to tell my friend about you. There's a poor
Yeah,
French guy who has moved over here and he's dating one of my friends, and that poor man has seen his country go to hell. But yeah,
yeah. I know they wouldn't. My guys would not like that at all. My God, I don't know how they would sit. A lot of them luckily got their passports and went to other
yeah,
countries, and they
yeah.
just, you know,
He's a
some
French
of them
citizen,
left.
so like that's a little different for him. But he got out probably 10, 15 years ago. I saw the writing on the wall, and he's like, I'm
Yeah,
out.
yeah, yeah. They were the ones I worked with were either really good badasses or pricks, one or the
That's
other.
about standard.
But
So
There's not no middle
yeah,
ground there.
no.
nah,
Gotcha.
no,
So just kind of give us a little. How did you end up? So you got a book called, was it The Pope's Paramedic? How
yeah.
how in the hell did you end up with that kind of a career? Explain what happened and just in a brief overview. We might do a deep dive on this too because you got a book and I want to cite your book
Yeah,
because it is
yeah,
on it is online. It's on Amazon. It's under one of the Kindle
it
things.
is. But my girlfriend is actually an editor, and she's currently, even today, rewriting. So and
Okay.
updating. So
So
we're gonna have a
hold off on it. But
better, yeah, and more
okay,
updated
so it's called The
version.
Pope's Paramedic: How
What
I Learned to
it
Cheat Death
is,
and Save Lives.
what I did is when I was in Africa, I you work with how can I put it? You work with a bunch of different countries, ex
Yeah.
SF, soft guys, and ex
Yep.
intelligence guys, and they all work as contractors because that's who the Americans want to send as contractors. So one company I worked with, the guy had been in the Italian military, and he had also been in the American military. He was in actually I think he was in a 173rd. He was in Vincenza, whatever airborne unit is
Yeah.
in
Yep.
Vincenza,
The
173rd.
173rd Airborne should be over there, I think.
Yes. So he and I worked together for a couple of years in Uganda, and we worked great together. He did weapons, and I did all the medicine, and then I would be his AI for weapons, and he'd be my AI for medicine. So he says, you know what? I have a friend who's grew up on the Vatican. He's like, would you like to meet him? I said, sure. So I went to Rome one time during our break, and it turned out his friend was the director of operations for the
Oh
Vatican.
wow.
And he says, I'm a fan of yours. He says, I want to learn. This is all in Italian because I don't speak
Yeah. Yeah.
Italian. But my friend from Africa spoke like six languages. This guy was like, he spoke Swahili, he spoke Italian, Spanish, French, Portuguese, English. He was great. So he's like, we both got picked up to come back to teach the Swiss Guard and another group of Italian folks that were heading over to Libya. We went there three separate times for a couple of weeks each time to teach them at a training area there in Italy, and I had a blast. I mean, the first time I went to the Vatican, I swear they treated me like a king. They gave me a private tour. They brought me through the museum, all the secret, beautiful statues. Then they put me up, and here I am, like I'm in a t-shirt. And matter of fact, I went, and the one day that I hit was a Wednesday, and that's the day that the Pope does his public
Oh wow.
mass right
Yeah.
there. So they sit me 4 people away from the Pope. I'm sitting with a t-shirt, my tattoos hanging out, and I was just blown away. I was like, I can't believe that the Swiss Guard didn't look happy, but I mean, I was so impressed. So I just went back and forth for a couple times, for at least 3 times to do training with them.
That's pretty cool.
And
I've
It
got a
was
couple Catholic
I
friends who are just going to be crazy excited to hear that, just this part alone.
yeah. Well, I got the Pope has rosaries. He gives rosaries out that he's
Yeah.
blessed. So I also met the chief cardinal, the second in command there, several times. So he took me into the Pope's room. I went with I'm with with my buddy there and his friend, the director of operations, and we're in the Pope's vestment room. So you're walking all around these secret areas of the Vatican. I don't even speak Italian. I mean, I'm Catholic,
Yeah.
obviously. I went to Catholic school for 8 years, but it just was very
Patriot
impressive,
man's
and they were
gonna
so
gonna
great
go
to me.
crazy hearing this.
They just I loved it because they were so every class they were such good listeners, such good students. I did a canine with they have Belgian Malinois. I did a canine class with them. It was just so much fun that I would have gone for free. Honestly, I really would have gone for free. But that's why I call it the Pope's paramedic, because they told me, they were like, no, we want you to know, no American has ever come back like this.
Yeah.
No American. I said, you don't learn tactics? They said, yes, we learned some from FLETC, from your, your Secret Service. We exchange information, but not like this. And I said, okay. So that's when I was writing the book. I thought, you know what? Seeing I have all the
Yeah.
tattoos, all the angel sigils on my body, I was like, I'm gonna call it the Pope's paramedic. So
Well,
that's where that came from.
that book's
Yeah.
now on my reading list. I'm sure Rabbit's gonna be digging that one up too. So
Yeah, I'll send you one once my girlfriend's, as I said, editing, and she does a great job. And when she's done, I'll
all
let
right,
you know, and we'll get one
sounds
too.
awesome. I know Rabbit, you got to get heading out, and I do want to have you back, so we will keep in
Yeah,
contact. There's you
definitely.
have 37 years, you have traveling across the country. I do want to do probably a deep dive in like austere medication and medicine, and
Hmm.
what trials and tribulations you have. I think Rabbit, that would be probably a good one that you'd enjoy as well.
Oh yeah,
Yeah,
you know me. I love talking to folks.
Yeah,
You
and I
know,
think I
I
think
just
he'll
like
have some
learning from.
crazy ones.
Oh yeah, and it's very unique to your the environments that you were in, and kind of like what we were speaking of before when we talk about organizations. We talk about civilian EMS versus military versus
yeah, yeah.
PMC versus, and I feel like each one kind of stays in their own field,
I think you're right.
and
Yeah,
it's sometimes
yeah,
hard. Like I didn't I not until you get into it, nobody's going and broadcasting. So hey man, there's a wildlife paramedic class you can go take. Oh hey, and it's certified. Oh hey, there's an international paramedic class. You know you can go do that. It's very like, oh
hmm,
hey, how about you just stay with your department and stay doing the street medic stuff, which there's nothing wrong with that. But at the same time, knowing that there's contracted paramedics going out fighting wildfires and hiking with the guys and doing the wildland
yeah,
firefighter thing, and there are these actual positions where if you like to specialize in tactical medicine or wildland medicine or wilderness medicine or in austere stuff, there are professional groups that are doing it, that not only can you gain experience if you love this stuff, you can make a job out of it in a profession. It's not just sitting on a bus and running calls. That's, I think, that's where everybody's got to go. But I mean, there's so many avenues, and I think sometimes that doesn't get projected well enough. Everyone just says, "Oh, hey, you become a medic, and then you become a flight medic, and you've peaked out." Like those are the two that you hear a bunch.
yeah.
They don't say, "Oh, hey, you can go and do this," and "Hey, you want to," or maybe teach. Those are kind of the three things I hear. Those are the three, just in a professional sense.
Options.
Yeah,
Yeah,
yeah, and it's
yeah,
like, hey, like especially young guy, if you have the opportunity, go overseas, do some humanitarian stuff, go learn
yeah. I
some stuff,
know. I
go,
know. I try to.
you know
Yeah,
and so
I try
I
to
know for
point people
myself that was
overseas.
something. So it's very awesome to hear your side, and always see all those stories are just a boatload of things to learn, and so I appreciate the
Yeah.
time.
Well, listen. Pleasure letting me ramble. I'm sorry. If I get off on a tangent.
No, I love
block
tangents
me
here.
at
This
Tangents
is the whole
that's all
show
we
is.
do. Yeah. it's a tangent. It's me asking some stupid question on medical stuff. Now, if you talk to me about radio stuff, I can educate people on radio stuff, and then I'll have historian on, and a historian will make me look like an idiot. Yeah, like it's common guys. Obviously, a podcast coming off the shelf. The people listening know the name. You just kind of got wrangled into this, and it's common guys talking about common stuff. But we like the professionals to come in and tell us idiots what we don't know or what we should be looking at, because you have the experience, you have the time, you probably have some of the best credentials because you've worked in areas where there's absolutely nothing. So. Roger. Yeah, we'll get you back on. So keep your shovel sharp and don't be a loot drop.
We'll catch you next time.
So the last few minutes of the podcast, we had a few issues, technical difficulties. I was having technical difficulties, and that's not on Ian's side this evening. I think the audio came in just fine, and I'm probably going to leave in all the ums and the uhs and the stupidity, because I think this needs to get out. I'm definitely going to have him come back. The guy's got a font of knowledge that we don't come across regularly. There's people out there, be prepared, some other guys that are phenomenal at this stuff, but you rarely come across a guy that's willing to chit-chat about this stuff. And with that said, tell me what you want me to ask this guy, and I will do my best to go down and drag out as much information as I can when I can with him. I will eventually do the water story with Rabbit sooner or later, and we've probably got another guy who's going to be super interesting, but less on the prepping side, more historical stuff, but he does talk about marine prepping, so I'm going to get him up next. Just phenomenal people that I've come across just by getting on X and chit-chatting. So if you guys got any questions, message me on X at glogistician.com or glogistician on X, and Liquored Rabbit on X as well. Just message us, send a direct message, and let us know what you think and what we can do to ask him, or what you think we should be asking him and we're not. You guys have a good night.